My hands are washed. I'm entering my patient's room. My name is Disha. I'll be your nurse practitioner for today for your routine annual physical. You don't have to worry about anything. You can be comfortable with me. Everything what you say here, it will be private unless you are trying to harm yourself or like to other anybody else. I have to report. Okay? You can be comfortable. Can you please tell me your first and last name?
My name is Angelina Sebastian.
Can you tell me your date of birth?
December 1st, 2009.
Okay, thank you. This is Angelina Sebastian. Her date of birth is December 1st, 2009. She's here for her routine annual physical. No chief complaint at this present. No past medical history. No past surgical history. No family medical condition as per her mother. Birth history includes she was a full-term baby, 40 weeks gestation, delivered via cesarean section, and she was weighed 6 pounds 10 ounce, 18 centimeter long. Her head circumference was 34 centimeter, and her ABGAR score was 10 out of 10. She is not allergic to anything like including food, medications, pollen, environmental allergies or latex. Her vaccinations are up to date, including HPV vaccine, COVID vaccine with booster, and flu vaccine. Angelina, are you in any pain?
No.
Okay, she's not in any pain. Her vital signs are normal, which is blood pressure is 100/60 mmHg, heart rate is 72 beats per minute, respiration is 18 breaths per minute, and temperature is 98.4 degree Fahrenheit, and SpO2 100% in room air. Mood is calm. She's appropriately dressed for the weather, and her skin tone is appropriate for her ethnicity. Her current weight is 98 pounds, and her current height is 5 feet 1 inch, and she's at the 95th percentile for her developmental age, and her developmental milestones are meeting properly, and there is no parental concerns at this time. First, we are going to start with your head assessment. So I will be looking at your distribution of your hair, and I will be looking at your scalp examination, looking for any depression or any dimpling of your head and the hair distribution. So looking, the first is the inspection. Now I'm going to palpate your skull also, looking for any bump, lump, or any depression or any contour like that. And now I'm moving down to your occiput. Okay, your occiput looks normal. She has a normal hair distribution, and no dimpling or no lumps or bumps noted. So normal finding. Now moving down to your face, first inspecting, looking at your symmetry of the face, and I'm looking at any involuntary movements. There is no involuntary movements noted. So face is symmetrical, and also I'm looking at your eyebrows and eyelashes. There is no crust noted. Now I'm going to feel your temporal artery. Temporal pulse I'm feeling, okay? And I'm moving down to your temporal mandibular joint. Can you open and close your mouth? One more time. That's normal. And now I'm going to feel your frontal sinuses. Do you have any pressure?
No.
Any pain?
No.
Okay, I'm going to feel your maxillary sinus also. Any pain?
No.
No. Any pressure felt?
No.
So this is a normal finding. Now moving on to the eye examination inspection first. So I'm looking at your eyebrows and eyelashes, and your symmetry of your eyes, and which is symmetrical. Now I'm gonna look at your sclera, and this is nice and white. It should be nice and white. It shouldn't be yellow, so it's normal. And I'm looking at your conjunctiva, palpebral conjunctiva. So there is no pale noted. This is nice and pink, so which is a normal finding. Now palpating the external structure of the eyelid, and checking for and then there is no chalazion or hydrolum noted. I'm checking for the nasolacrimal duct, there is no drainage noted, there is no hardness or it is intact, so which is normal. And I'm checking the strabismus. I'm going to cover one eye and uncovering, and there is no like extra movement noted, so which is negative for strabismus. I'm doing another her like left eye covering and removing it. There is no extra movement noted in the covered eye, which is negative for the strabismus. And now I'm checking for the slant of the palpebral fissure. So looking at the upper eyelid and the lower eyelid, and then the outer canthus, the measurement, which is slightly up, which is normal. Checking the right eye, upper eyelid and lower eyelid, and the slant of the outer canthus is slightly like upward, which is normal. In microcephaly, it's really upward. This is negative finding for her. So now we are moving on to the hypertellurism and tellurism, which is I'm measuring the I'm using the chart to measure the right eye and left eye inner canthus, which is now normal, and checking the outer canthus of the right eye and the outer canthus of the left eye, which is also like in the same distance. So there is negative for the hypertellurism and tellurism, which is a normal finding for her. Now we are moving on to the visual acuity test. So Angelina, can you close your right eye and read the bottom line with the left eye?
LTFPH.
We're gonna repeat with the other eye.
LTFPH.
So it's 20/20 vision, which is normal. And now we're gonna be like, I'm checking her peripheral vision. So can you close your right eye? At the same time, I'm closing my left eye. And tell me what number finger you see it.
1, 2.
So switch.
1, 2.
Okay, peripheral vision is intact. Now moving to the H test, which is visual acuity EOM. Extraocular movement we are checking. Okay, so like follow my fingers. Okay, I'm looking at the accommodation also. Her eyes are like accommodating well. Now using the pen light to check the shining the light on the left eye and looking at the right eye, and it's constricting. And I'm shining the light on the right eye and checking the left eye, and it's constricting, which is normal finding. Pearl eye is positive. So like people are equally reacting to light and accommodating, so which is normal. So now I'm using the ophthalmoscope to check her red reflex. I'm angling 15-degree angle, and then I'm using my right eye to check her right eye, and using my left hand to touch her right shoulder. So about here I can see her red reflex, and you can follow through closer. You can see the blood vessels, optic disc, and physiological cup. So when it is going to the nasal side, you can see the macula and fovea. So same thing on the left side. We are checking the left eye of the patient using my left eye, and using my right hand to touch her left shoulder. So now I can see the red reflex following down. Same thing, like you can see the you can see the blood vessels, optic disc, physiological cup. So now you go into the nasal side, you can see the macula and fovea. Moving on to the ear exam, every other system same, like we are also looking at the inspection is the first one. So looking at the size of the ear and placement of the ear, checking it is aligned with the outer canthus of the eye to the the ear is the same both sides, so it's negative. And do you notice any muffled sound or any drainages from your outer ear, like ear canal?
No.
Okay, so I don't see also. So inspection is normal. There is no drainage or anything noted. So now I'm going to like do a whisper test. This is like I'm going to like close your ear and say like 2-syllable word.
Apple. Banana.
Okay, so that is normal. She is able to verbalize that. And then now I'm going to check the tap test. Usually like pinna or tragus, like we just move up and down. If any pain or swelling, there is a sign of infection, but there is no pain or any pain.
No.
Okay, what about this side?
No.
No pain or swelling noted, so which is a negative finding. So moving on to the otoscopic examination. So like we are checking the external canal and tympanic membrane of the inner ear. So like in more than like 3-year-old, like you have to pull the pin up and back to see it visualized properly. So her tympanic membrane is pearly white in color, which is normal finding, and if it shouldn't be red or bulged. And I can see her malleus and umbo also. So we are using this the same way on the her left ear. So the same way you can always like embrace with the 3 fingers over here. So because the younger people, like the children's, like they can move the ear, so you can do this. And I can see the same thing, there is no redness. This is pearly white in color. So moving on to the last examination of the ear, which is a conduction study. So Weber test, I'm performing the Weber test and ring test. First Weber test. So I am striking the tuning fork and and placing it in Angelina's forehead or the crown, and she has to feel or hear. So first Weber test. Do you hear?
Yes, I feel it in both.
Both, which is normal. She should feel it in both ears, and if it is not in one side, it can be a like hearing loss or conduction loss. So now we are moving to the ring test, and I'm striking it again, and I have to place the tuning fork in the back of the ear, and I will bring it in the front of the ear. So which I am going to perform. Tell me when it is stop.
Stop. I can still hear.
You can still hear, which is air conduction is greater than bone conduction, so which is normal for her. I'm going to do the same test in the other right ear. Can you hear it?
Stopped. I can still hear.
Still here, which is normal for finding for her. Moving on to the examination of the nostril. Again, inspection. First, inspecting the nose. There is no visible deviation noted, so it's negative. Do you notice any discharges from your nostrils?
No.
Do you like feel any like anytime you cannot breathe properly? Do you felt like that?
No.
Okay. Can you close your eyes and close one of your nostril and say like what is this smell like?
Lemon.
Okay. Repeat.
Lemon.
Okay. So which is good. You can smell properly. So I'm going to palpate your nostrils. So like looking for any deviation. There is no deviation present from the palpation. I'm checking the maxillary sinus. Do you feel any pressure?
No.
Okay. Any tenderness, pain?
No.
Okay. Frontal sinus also same. Do you feel any pressure, tenderness? No. Okay. Percussing?
No. 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 No.
Which is normal finding. Now I'm using the pen light to shine the light on your nose. If you want, you can close your eyes. I'm using my thumb to uplift, looking at. Okay, the same way the other side. There is no deviation noted. Also, like there is no bagginess, no drainage, and it's clear. So there is no septal deviation noted, so it's mostly clear. So in the nostril there is no polyps also noted. Now moving on to the mouth, I'm checking the external mouth, inspecting the external mouth. There is no lips or no crack noted, no lesions or no herpetic lesions or lumps noted. So now Angelina, can you open your mouth? I'm using the light source to see, like, can you stick out your tongue? I can see the uvula in the middle, and I can see the tonsils are on the both sides. There is no enlargement noted. Her tongue is there is no varicose vein noted also. Can you lift up your tongue? The sublingual glands are intact and good. I can see the dentition also. I can see. I'm going to put the gloves on to see the mucosa, buccal mucosa. So the buccal mucosa is pink and moist. There is no mass or lesions noted. Soft and hard palate is intact. And now I'm checking the cranial nerves. So Angelina, can you stick out your tongue? Say ha. So her gag reflex is intact. So glossopharyngeal nerve, cranial nerve 9 is intact. Can you repeat my words like I am good?
I'm good.
Okay, can you swallow? So without any stutter or anything, like she's able to repeat my words, and like she's able to swallow. So the vagal nerve and cranial nerve 10 is intact. Now I'm going to check the cranial nerve 12. Can you stick out your tongue? Can you move side to side? So her hypoglossal, which is 12th cranial nerve is intact. Now moving on to the neck examination, starting with the inspection of the neck alignment. So I can see her neck alignment is normal. Her trachea is in midline. I can see that, and there is no torticoliosis noted, which is like there is no twisting of the neck or there is no twisting of the neck noted, and there is no goiter noted also. So now we are moving to range of motion. Angelina, can you turn your head to the right side, to the left side, up and down. Now I'm palpating the lymph nodes of the so like first is I'm using the 3 pads of my finger, so palpating the lymph node of the pre-auricular, post-auricular, tonsillar, submandibular, submental, anterior cervical, checking the posterior cervical, deep cervical. So can you turn to the other side? Okay, the other way. Supraclavicular lymph nodes, checking the infraclavicular lymph nodes, checking the occipital lymph nodes. Normal lymph nodes are pea-sized, mobile and non-tender, which is hers. So now I'm feeling the carotid pulse of the right side. I'm feeling the left side of the carotid pulse. Feeling the I'm palpating the trachea, which is in midline. I'm using a posterior approach to check her thyroids. I'm feeling the cricoid process, and on the sides I'm checking. Angelina, can you swallow? Okay, I'm feeling there is no lymph nodes noted, which is normal. Okay, you can come back. So this concludes the HEENT assessment. Thank you, Angelina. As an anticipatory guidance, I discussed with Angelina on topics such as acne, care of her skin, body image, bullying, peer pressure, parent pressure, drinking, drugs, safe sex practice, STD, STIs, firearm safety, seatbelt use, importance of immunization and addictions. Also, I screened her for depression using the PHQ-9 tool. Her PHQ-9 score is 0, which is normal. So, the summary of my finding: no abnormal finding noted at this annual physical. Her ICD-10 code is Z00.129, which is a routine child health examination without abnormal finding. No referral needed at this visit.